Hepatitis B, as you say, is largely a disease of adults because of the same reasons that you suggest. Things like needle sharing or exchange of blood, blood transfusion in some other countries, all of these can give you hepatitis B. However, the risk of contracting hepatitis B can come at any stage in life, and it is therefore useful to immunize babies from a very early age.
So does this mean that the children will be immunized as adults?
Yes, they retain their immunity through life through the 6-in-1 vaccine, which is given as 3 doses through infancy.
So, as you say, 6-in-1, but will you be offering a separate vaccine for hepatitis B for adults?
There is already a program, and this is particularly for people at high risk. There are people who are either drug users or, for example, pregnant mothers who already have hepatitis B. There is already an immunization program dealing with people at high risk and prevention. And hepatitis B is also used for people who are traveling abroad and might expose themselves to risk.
Around 20 years, I believe it was, we had a scare with the MMR vaccine, and that made some parents reluctant to give their children immunization. Do you think that this has had an effect?
Yes, it did have an impact. As you say, this happened in 1998 when a person produced a lot of scurrilous and wrong propaganda against the MMR vaccine. Since then, the MMR vaccine has been extensively researched by the World Health Organization, and research trial after research trial has vindicated it, proved it to be one of the safest vaccines available on the market. So yes, however, there was an impact, and a lot of people in Gibraltar did not vaccinate their children. All of this came to a head in 2008 when we had that massive outbreak of measles in Gibraltar, and it affected only the children who had not been vaccinated. Fortunately, all survived, and we don't want a repeat of that sort of thing.